There are two groups of people that we need to motivate. So where does the motivation start? It starts with the leaders. One of the phrases that has impacted my life most is leaders lead always. Leaders lead always in their attitude, in their conviction, in their excitements, and how they express what's going on in their hearts and minds. So first, to those of you who are watching this video, if you consider yourself a leader, then you need to make sure that you know leaders lead always. To those of you who are not sure if you're a leader, I encourage you to ask yourself that question as we go through the rest of this course, because leadership is more often than not just a choice. So, leaders lead always. Now that we've decided that we are leaders, or that we are going to lead with our attitude and motivation first, who are the other groups of people that we need to motivate? Well, first is obvious. We need to motivate our team. How do we motivate our team into action? The second is patients. How do we motivate our patients into treatment? Like I said earlier, sleep is an invisible killer, not a silent killer. It's usually pretty loud, but an invisible one. We're trying to get people to see the invisible. So how do we show them the invisible and show them the impact that it's having in their own life? We're going to explore that and much more further in this course. So let's talk about the team briefly. What are some of the considerations we have in motivating our team? First, who's in the team? Who do we consider home team? Second, what are they doing? If we have the team put together, where is the bus going? We'll talk a lot more about that in lessons to come. What is their personal why? What is our corporate why? How do personal why and corporate why play a role in communication together? How do we make sure that our team takes action? Understanding that motivating them to take action is critical to our success individually as it is a team. Having rewards and consequences for the type of actions that we take. Understanding that rewards and consequences, although it sounds kind of scary, it may not actually be as unpleasant as we think it must be because of the things that we've learned before. The last thing is we're going to make sure to have a heavy focus on this idea of listening. I always joke around with my family that God gave us 2 ears and 1 mouth. But the reality is that so many people don't listen. We're going to talk about some things to encourage you growth in this area and just kind of ask you some hard questions. So the biggest thing I want to leave you with in this video about listening is we first listen to understand and then to be understood. After we talk about motivating the team, we need to understand the key components of motivating our patients. So let's talk about motivating our patients. Motivating our patients as it relates to sleep apnea is a really fun topic because there's a couple things that we got to be careful of. The first thing is no one wants to be saved. If you've been a part of our Sleep Hero Network platform or you've heard us speak, you've probably heard the story of my first date with my wife-to-be. So it was my first date. She got a flat tire. I came in, saved the day. It was a great story. And she does not like it that I tell it because she sounds, in her mind, like this millennial who can't change a tire. She didn't like the story because she didn't like to be saved. So we'll talk more about that dynamic and maybe reference that story in more detail. If you are looking for that story, check out our screening course. That screening course will have it in much more detail. So how do we make sure that we're not saving people, but encourage them to move to action? But also, how do we avoid insulting people? Sleep apnea is one of those things that affects all of our areas of health. So it is correlated that we will see people with type 2 diabetes or obesity or tiredness. And how do we make sure that we don't accidentally insult their weight and make sure they absolutely close us off and make sure that we're actually communicating our concern to them about the signs and symptoms of sleep apnea, making sure that we are heard and they're not on defense. And the last thing is we just have to make sure that we're using common sense. The phrase common sense isn't so common is an unfortunate reality in our culture today. So I'm going to talk about some common sense things and put quotes around those because they may be a little bit less common sense than we think. But if we remove ourselves from the clinical side of dentistry, the clinical side of dental sleep medicine, we're going to find that this all makes really good sense. So when we talk about motivating these two groups of people in our further sections, just be open-minded. Remember, this is a different type of course. So when we talk about changing the way that we think or looking at a situation, it will play a critical role in how we can motivate ourselves, our team, and our patients.